In this video, I'll demonstrate my approach to the surgical management of Reinke's edema. This was a middle-aged lady with a background of heavy smoking and reflux, who presented with a low-pitched, rough and hoarse voice with reduced pitch range and impaired pitch control. Her symptoms had not improved despite conservative management, including reflux treatment and speech and language therapy. Her preoperative flexible nasendoscopic appearances and a sample of her voice are shown here.
When the sunlight strikes rainbow in the air, they act a prism of former rainbow. The rainbow is a division of white light into many beautiful colors.
Reinke's edema causes a characteristically deep, husky dysphonia due to accumulation of fluid within the superficial lamina propria, or Reinke's space. This increases the mass of the vocal folds, lowering their fundamental frequency and reducing the ability to generate and control high pitches. I begin by placing a wet gauze beyond the vocal cords to protect the distal airway during the use of the CO₂ laser. I then create a lateral microflap incision using the laser at low power on minimal spot diameter settings. The purpose of the laser is simply to separate the epithelium and gain access to Reinke's space. So I use short applications and aim to minimize thermal injury to avoid charring wherever possible. The incision is extended along the lateral aspect of the vocal fold. The vocal fold is gently grasped with heart-shaped forceps to provide counter-traction and place the epithelium under tension. Once Reinke's space has been entered, I introduce blunt forceps beneath the epithelium. These are gently opened and closed to develop the plane and encourage egress of the edematous material. The key principle throughout this dissection is preservation of the vocal fold, epithelium, and underlying vibratory tissues. Once the edema has been adequately evacuated, any clearly redundant mucosa can be conservatively trimmed using curved microscissors. It is important not to over-resect this tissue, as the aim is to preserve sufficient epithelium to redrape over the vocal fold and restore a smooth vibratory surface. The same process is then repeated on the contralateral side. In bilateral disease, particular care is required anteriorly. I avoid extending opposing incisions towards the anterior 1/3, as bilateral mucosal injury in this area risks post-operative scarring and anterior glottic web formation. As before, the lateral microflap is fashioned, Reinke's space is entered, and blunt forceps are used to gently develop the plane and evacuate the edema. Again, we can see preservation of the overlying microflap and clearly excessive redundant tissue is conservatively excised using the microscissors. Once both sides have been addressed, microflaps are repositioned and the vocal folds inspected endoscopically. On the right, we can see a smooth, well-defined free edge. On the left, however, there is still a small amount of residual edema anteriorly. I therefore re-enter through the existing microflap incision with blunt forceps and direct these anteriorly. An adrenaline-soaked pledget is applied externally to gently milk the residual edema towards the microflap incision. Following this, the residual swelling has reduced and we can see a much smoother and more symmetrical contour to both vocal folds. Post-operatively, the patient is advised to maintain strict voice rest for the first 48 hours, followed by structured rehabilitation with the speech and language therapists. Management of contributing factors is equally important, and in this case she continued her reflux management and, importantly, completely stopped smoking following surgery. At 2 weeks, flexible nasendoscopy demonstrates good early healing with no recurrence of the edema, and by 2 months the vocal folds remain well healed with preservation of a smooth, free edge. We can also compare her voice before and after surgery.
When the sunlight strikes rainbow in the air, they act a prism of former rainbow.
The rainbow is a division of white light into my beautiful colors. It's a division of white light into many beautiful colors. This takes the shape of a long round arch.
I hope you enjoyed this video. Please consider liking and subscribing for further content.